Hello, my name is Claire. I'm going to be performing my urinary catheter insertion checkoff on a male patient. So the very first thing that I'm going to do is I'm going to check the healthcare provider order, which I have here on my paper chart. I'm going to verify the patient's name, date of birth, and allergies if there are any, particularly any to latex, because catheters are sometimes made out of latex. I do see an order here for an indwelling urinary catheter insertion for urinary retention. So now I'm going to go ahead and gather all of my supplies. I'm going to don some procedure gloves, which I have here. I'll don them when I get in the room. I have some hand sanitizer. I have a roll of tape to secure the catheter to the patient's leg, and I have my sterile catheter kit at this time. So now I'm ready to go into the patient's room. So I would knock on the door. I would say, "Hello, my name is Claire. I'm going to be your student nurse today. Could you verify your name and your date of birth for me, please?" The patient would tell me his name and date of birth. I would verify that against his armband and the electronic record, or the paper record in this case. I would ask the patient if he has any allergies, and if he says no, then we are okay to proceed. And if he has any allergies, particularly to latex, I would want to know what that reaction is. And then I would ask the patient about his medical history, but first I would say, "I'm here to insert a urinary indwelling catheter that your healthcare provider has ordered for you. Is that okay if I go ahead and do that today?" And if he would answer yes and give me consent, and I would ask him about his history, if he has had any urethral strictures, or if he has any prostate issues that he is aware of, or if he has had any problems with a urinary catheter in the past. Or the last one would be if he has ever had any surgeries on his urethra or anything like that. So I'm going to inform the patient that I'm going to be inserting a urinary catheter, but first we're going to have to perform perineal care, which I would have grabbed those supplies as well before coming into the room, but I'm going to be verbalizing it for the sake of this checkoff. So at this time, I'm going to don my procedure gloves. Well, first, actually, before I put the gloves on, pretend that did not happen, I am going to make sure that the patient is safe and make sure that there is nothing on the floor that could cause a tripping hazard or a slipping hazard. I would make sure that the bed breaks are locked. I would raise the bed to a comfortable height for the sake of this checkoff, because I cannot raise the height of my bed. I have a seat here that I will be sitting in, so I'm not stooping over my sterile field. I would make sure that the privacy curtain is closed, and then I would go ahead and expose the patient. So I'm going to expose him from the bottom up, so his top half can still be covered and warm. I'm going to expose the penis. Now I'm going to put on my procedure gloves. And at this time, I would perform perineal care with the hospital-approved cleanser or the facility-approved cleanser. I would have a basin with that, with washcloths or with wipes, whatever the facility protocol is. And I would go ahead and I would clean the head of the penis, the shaft, the glands, everything of that nature, and I would pat that dry. And I would also visualize the urinary meatus, the urethral meatus at that point. And then after I was done with that, I would go ahead and remove my dirty procedure gloves. And I would throw those in the trash. And then I would go ahead and perform hand hygiene as soon as I took my gloves off. Okay. And I would let the patient know that at this time, I'm going to start the sterile procedure of putting in the urinary catheter. I'm going to go ahead and grab my catheter tray. I'm going to set it on at the bottom of the bed here. And because of the stooping over issue, I will be sitting in a chair for the remainder of the checkoff. I'm going to go ahead and take out the tray. And I'm going to form a trash bag with the bag that the tray came in. And I'll place that at the head of the bed. And I will go ahead and I will take off the paper. And next, I'm going to open up my catheter tray. The patient is in a supine position, which is acceptable for this procedure. Okay, I will stand up for this one. I'm going to take the waterproof edge of the drape, and I'm going to drape it underneath and in between the patient's legs. So I'm going to go ahead and take it, let it open naturally, touch the waterproof side only. I'm going to place it in between the patient's legs. And if that did need to be fixed, I could fix it once I put on my sterile gloves. Now, next step is for me to put on my sterile gloves. And so it is in view for you. I'm going to do it right here, which I know is within my sterile field, but I want to do it where you guys can see. So I would normally never do this, but I'm going to place it right here. I'm only going to touch the cuff. Put on my first glove. I can go ahead and fix that in a minute. And I recognize that my glove did rip and I would need a new set, but I do not have an extra set, so we're going to continue. With hitchhiker thumb. Okay, now I have my sterile gloves on, and now I can go ahead and touch anything within the kit. I'm just going to move this out of the way. I can go ahead and take my fenestrated drape, and I would go ahead and I would place it directly over the penis with the waterproof side down. And touching the sterile to sterile parts. Okay, and now is when I would organize my kit. Now, so I am not going to contaminate. I'm going and hang over my kit. I'm going to go ahead and organize this way. And I do recognize I should be a little bit higher above this. So now at this time is when I would go ahead and prepare my antiseptic solution. I would go ahead and pour that, rip this off and pour it over my cotton balls. I would take it away from my sterile field, drop it in the trash, and then at this time I would go ahead and I would take my lubrication and place that in the tray as well. And I would go ahead and throw that in the trash as well. And since we do not need a urine sample at this time, I can go ahead and discard the urine cup. And I can go ahead now and take the catheter out of the sheath. I'm going to also check and make sure, which I can see here, that my bag is clamped, but you do want that clamped so that way no urine runs out. I'm going to go ahead and take the catheter out of the sheath, wrapping it around my fingers to make sure that it doesn't splay everywhere. I'm going to go ahead and throw away the sheath. And I'm going to place my catheter directly into the lubricant. It's a little bit floppy, but it never went out of the sterile field. Okay, and next I'm going to take my syringe full of 10 milliliters of normal saline, which I will use to inflate the balloon. I'm going to connect that to the injection port here. Okay, and now at this time I'm going to clean the penis. Now, because my sterile field and my sterile tray is a little bit far from the penis, I'm going to move it up just a little bit by touching the sterile field and dragging it up this way. Okay, and now I'm going to use my forceps to grab the cotton balls. And I'm going to use my non-dominant hand to hold the penis at a 90-degree angle. And I'm going to use 3 cotton balls to clean around the head of the penis and around in bigger circles, not crossing my sterile field, to throw those away. Take a second one to clean the penis. Throw that away. And one more time to clean it. And because of sterility, I'm going to throw away my forceps as well. And now at this time, I'm going to take my catheter, which has been lubricated, and I'm going to bring it close to the patient. And I'm going to ask the patient to bear down as if he is going to urinate just a little bit. And I'm going to insert the catheter into the urinary meatus, urethral meatus. That's okay, that's all sterile, even if it does flop over. And I'm going to insert the urinary catheter with my right hand all the way down to the bifurcation, and until I see urine that is coming through the tube. I'm going to use my non-dominant hand to secure at the bifurcation. I'm going to use my dominant hand, which is still sterile technically, to insert the 10 milliliters of normal saline to inflate the balloon of the urinary catheter. And at that's okay. I did get all 10 milliliters in there. And now at this time, I can go ahead and discard of that. I can let go with my non-dominant hand. And at this time, I can go ahead and give this just a gentle tug because it will retract on its own a little bit. And at this time, I would go ahead and take the urinary catheter bag, and I would make sure that it's hanging at a lower position than the patient. So I would hook this onto the side of the bed for the patient. But for our purposes, I don't have hooks on the side of my bed, so this will have to rest down here. But normally it would never rest on the floor. And now that the sterility of the procedure is over, I can go ahead and I can clean up all of my supplies. I would provide peritoneal care to the patient as needed. And I would go ahead and I would take all of my supplies. And I can rip this here to get this one off. I can go ahead and pat dry if need be. Okay, I would go ahead and clean up everything. Once I was done and I threw everything in the trash, I could go ahead and take off my gloves. And I would perform hand hygiene at this time. Then I would go ahead and I would take a piece of tape to attach the catheter to the patient's legs. This doesn't want to give me an edge. I'll go ahead and secure the tubing to the patient's legs, not the catheter itself, below the bifurcation. And at this time I would say, are you comfortable? I know that was a little bit uncomfortable, but are you okay now? I would go ahead and make sure that the patient is covered back up and not exposed. I would go ahead and then I would take the time to document in the chart. I would document the size of the catheter that I gave, which was a 14 French. I would document the color, clarity, and if there was any odor of the urine that came out and the amount. And I would also document that I gave the 10 milliliters of normal saline in the balloon of the catheter. And then I would go ahead and document that it was given and it was tolerated well. I would go ahead and make sure that my patient is comfortable and safe. I would make sure that my patient has the call light, that the patient has anything that he could possibly need. I would make sure that the bed rail is back up. I would make sure that the bed is in the lowest position. I would go ahead and take all of the necessary trash out of the room and make sure that the syringe from the normal saline was placed in the sharps container. And then at that time, I would go ahead and sanitize my hands one more time before I was leaving, and I would come back and check on my patient in an hour.